COVID-19 death toll continues to climb in Michigan prisons, claiming prisoners and those paid to care for them. These are the faces of the 50 prisoners and 2 prison employees who have died. Tonight, as corrections officers complain that the state is not doing enough to protect them, Target 8 investigator Ken Kolker is examining each death behind bars.
Lakeland Prison here in Coldwater is known as the state prison's nursing home, which is one reason that so many prisoners have died of COVID-19. The virus has also killed in 10 other state prisons, taking the relatively young and old, more than half of them murderers, another 13 sex offenders, according to records reviewed by Target 8 through Thursday. Many were never going to get out alive, 22 serving life without parole, others with sentences so long that they had little hope of ever getting out.
You should care because they're human beings.
But at least 17 were likely to have gotten out eventually. COVID-19 was their death sentence.
The judge never said, I'm sending you to prison to die.
Daniel Manville, a former prisoner himself and now an attorney, helped file a federal class action lawsuit against the state prison system for its handling of the pandemic. He accused the prison director of not acting fast enough.
If they're going to die, let them die of natural death. Okay? I mean, don't let them die because of the coronavirus, because you are not providing them care.
He says the state should reopen some of its empty, mothballed prisons to help spread out prisoners, making it easier to keep them 6 feet apart.
They're letting them go to the yard together as a group. They're letting them go to the mess hall.
Target 8 recently found dozens of prisoners gathering in groups in the yard at Lakeland.
What we're trying to do in this is spread these people out.
The state prison spokesman denied the system was slow to respond.
They're all human beings, and so every life is important to us, and we're doing everything we can to keep the number of deaths low.
The dying started on April 1st and hasn't stopped. A Target 8 analysis found that the average age of prisoners claimed by COVID-19 was 66, far below the average for others who have died in the state, 75 years old. The state says most had underlying conditions. The youngest was a 47-year-old convicted killer, the oldest an 86-year-old sex offender. All but 3 were men, about half were black, half were white. Most committed their crimes in the Detroit area, but 13 were from West Michigan. They include the 86-year-old Eugene Shingle, serving 2 to 15 years for molesting a developmentally disabled girl on his Hamilton school bus in 2007, and 58-year-old Gregory Kelly, a pimp who beat prostitutes in Grand Rapids. At Lakeland Prison alone, where half the prisoners are elderly or sick, 18 had died, more than any other prison.
It does look like a nursing home. You see prisoners, people in wheelchairs.
He said the MDOC feared what would happen if COVID-19 hit Lakeland.
You don't want to have it at any facility, but we really didn't want to see it at Lakeland.
You know, prisons are small communities, and there's a lot of individuals that are pushed into a very small space. And so you get a virus like this, it works its way through the system until it has no more individuals to infect.
Unions for corrections officers and other prison workers say the state is not doing enough to keep them safe.
The state's lacking in proper PPE.
Personal protection equipment.
Officers know that, hey, we signed on to this. Our job is to protect the community and keep these prisoners safe and orderly. It's an extra burden when you come in knowing that, hey, I don't have the proper PPE to protect myself against this contagion that's in here.
He says nearly 300 of the state's 6,000 corrections officers have tested positive.
You know, they're scared just like everybody else.
2 workers have died, including 50-year-old transportation officer Damon Burton of Detroit. He was set to retire on April 1st. He died the day before. While the state says that those who work directly with infected prisoners have PPE, N95 masks, goggles, gowns, and gloves, most others wear cloth masks. The union wants the same protection for everyone.
Folks' primary concern is the potential to bring the virus home to their families.
The MDOC spokesman says the state is spending millions to fight the virus and is following CDC guidelines. The state, he says, is releasing record numbers on parole, sanitizing prisons, plans to test every inmate, and separates those infected from others who are not. Prisons, he says, preach social distancing.
The message is out there, and if the prisoners aren't heeding that, we have staff, obviously, who can remind them, prod them. But at the end of the day, there's not a whole lot that you can do if they want to, be gathered in these groups.
Reopening old prisons to spread them out more, he says, would be expensive and time-consuming.
We've worked very hard to do everything we can to limit the spread.
The MDOC says that at least a dozen prisoners are still on ventilators at secured hospitals across the state. In Coldwater, I'm Targeted Investigator Ken Kolker.